Depression is a serious medical condition that affects millions of people worldwide. It's not just feeling sad or down, it's a complex illness that impacts every aspect of a person's life. Imagine a heavy weight pressing down on your mind and body, making it difficult to find joy or motivation. That's what living with depression can feel like. Unlike fleeting moments of sadness that we all experience, clinical depression is persistent and overwhelming. It drains your energy, disrupts your sleep, and makes it hard to concentrate. While sadness might be triggered by a specific event, like a disappointment at work, depression often has no clear cause. The World Health Organization recognizes depression as one of the leading causes of disability globally. In the United States alone, millions of adults struggle with this condition each year. It's crucial to understand that depression is not a sign of weakness. It's a real illness that requires understanding and treatment. Depression manifests itself in a variety of ways, and its symptoms can vary from person to person. However, some common signs can help us identify when someone might be struggling with this condition. If you or someone you know experiences 5 or more of the following symptoms for 2 weeks or longer, it's essential to seek professional help. One of the most noticeable signs is a persistent low mood, a feeling of sadness and emptiness that lingers throughout the day. Loss of interest in activities that once brought pleasure is another red flag. Things that used to excite you, like hobbies or spending time with loved ones, might seem unappealing or even burdensome. Changes in appetite and weight are also common symptoms. Some individuals with depression may experience a decrease in appetite and lose weight, while others might find themselves overeating and gaining weight. Sleep disturbances are frequent companions of depression, with many people struggling with insomnia or excessive sleeping. Depression is not merely a state of mind, it has profound effects on both the brain and the body. Research has shown that people with depression often exhibit structural differences in certain areas of the brain, including the hippocampus, which plays a crucial role in memory and learning. Neurotransmitters, the chemical messengers in our brains, are also affected by depression. Imbalances in serotonin, dopamine, and norepinephrine, chemicals associated with mood regulation, pleasure, and motivation, are believed to contribute to the development of this condition. The causes of depression are complex and multifaceted, stemming from a combination of genetic, biological, and environmental factors. While there's no single gene that determines whether someone will develop depression, having a family history of the illness can increase the risk. Life experiences such as trauma, abuse, or chronic stress can also play a significant role in triggering depression. Moreover, certain medical conditions, such as thyroid disorders or chronic pain, can contribute to the development of this mental health challenge. Overcoming depression often requires professional help, and seeking treatment is a sign of strength, not weakness. Mental health professionals, such as therapists, psychologists, and psychiatrists, are trained to diagnose and treat depression using a variety of evidence-based approaches. Psychotherapy, also known as talk therapy, can help individuals identify and change negative thought patterns and develop coping mechanisms for managing their condition. Medication, such as antidepressants, can help correct chemical imbalances in the brain, alleviating symptoms and improving mood. If you're concerned about someone who might be depressed, the most important thing you can do is offer your support and encourage them to seek professional help. Let them know that you care and are there for them. Avoid dismissing their feelings or offering unsolicited advice. Instead, listen with empathy, validate their experiences, and help them find resources, such as therapists or support groups. Educating yourself about depression can also help you better understand what your loved one is going through and how you can best support their journey to recovery.